We want to ideally interpret data much earlier in the process than we currently do. So we don't want just to confirm histopathology, that's way too late, or even pathology, that's way too late. So we want to actually, at the time of diagnostic, when a patient comes in and say they're diagnosed breast cancer, we want to understand what type of tumor it is. How will that type of tumor react to a certain treatment regime? Can we stratify the patient to put them on a certain treatment path but not the other? Do they need some chemotherapy first to downsize the tumor, or some radiotherapy, or what kind of drugs do they need? Also, in one application I've been working on in colorectal cancer, there's the question that currently a one-size-fits-all approach is taken. A patient comes in and they get a fairly prescribed regime of chemo and radiotherapy. Now, these are quite often elderly patients. They don't take these treatments very well. It's a toxic regime. Quite a few actually die on the way during treatment already. Some patients respond incredibly well to the therapy, yet they still undergo surgical resection at the end because it's part of the treatment path. So they needn't do that. They would be cured, and they still undergo that treatment, but that surgical treatment, which shouldn't be the case. Others do not respond at all to that fairly toxic treatment, but so they could have gone straight to surgery. So if we could identify these patients very early in the process, it would kind of revolutionize the way these patients are treated. Another area I'm quite interested in is early prediction of cancer. So basically predict cancer before it's there. So that could help in diseases, for example, lung cancer, where usually the disease is only diagnosed when symptomatic. So patients are diagnosed mostly in the A&E. They've got a persistent cough, doesn't go away, and at that point the treatment options are quite limited. That's why the mortality is so high in lung cancer. But if we could see them earlier in the process, because they might have some chest infections, or they might have asthma, and in combination with being smokers, so we identify them being in some high-risk group, we can follow up their lungs, their lung images over time, and actually say this actually is starting to look not good, so we could actually do something much earlier, and that with that reduce mortality.